do you use the results of language proficiency tests in your practice?
In my practice as a school psychologist, the primary reason I use the tools would be to, for example, I want to figure out their language proficiency, right? Do they have sufficient language to access the academic curriculum? I mean, we get CALP scores, right? Usually. And then when we look at the CALP scores, we look at are they able to, what level of proficiency they have in that respective language. As we know, students are instructed in English only programs. And if we give a CALP in English, it gives us an idea of, okay, what degree of language proficiency do they have in that language to access the curriculum?
In terms of accessing the curriculum, is that focused on classroom placement?
Yeah. And that was the next piece to it, right? We're looking at, at least in my area, a lot of students are being taught in English only programs, right? So sometimes the question is it a difference or a disorder? It may just be a proficiency thing, right? Where maybe they're still developing their English skills, and perhaps what we're seeing is not a disorder, a disability of some type. It's probably just the fact that they're still developing their English. And because they're not able to tap into their L1 or their Spanish skills, it makes it difficult for them to fully access the curriculum in a setting where English only is expected.
In an English only academic setting, we probably get a lot more referrals for testing for bilingual students than we do in bilingual programs where they are able to tap into those L1 skills.
Exactly. Yeah. So most of the students were coming from English only placements, but these were kids that were bilingual, right? At home, they're speaking Spanish to their families, right? In school, they're in English only programs. So they weren't able to use the full spectrum of their language abilities. And a lot of those students are the ones that would come for testing. Those were the two primary reasons why I would use the language proficiency test. And also, I'm sorry, one more thing, to help interpret my assessment findings as well. A lot of my cognitive testing is language proficiency, right? Can they understand well? So it helps me also determine if they're really able to access the directions and the tasks on the test that I administer.